Welcome to TCM Board Formula Series. Today we review Gui Shao Yao San, Tang Ki, and peony powder. It belongs to the category nourish blood, soften the liver, and drain dampness. The herb photograph shows Bai Shao botanical, Paeonia lactiflora, medicinal part, root. The fastest memory hook is this: blood deficiency and liver constraint meet spleen weakness and dampness. Nourish, move, strengthen, and drain. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Bai Shao nourishes blood, preserves yin, and relieves abdominal tension. Gui nourishes and gently moves blood. Chuan Xiong invigorates blood and spreads constrained liver qi. Bai Zhu strengthens the spleen and dries dampness. Ling supports the spleen and leaches dampness. Ze Xie promotes urination and guides dampness downward. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Bai Shao. The deputy level is Gui and Chuan Xiong. The assistants are Bai Zhu and Ling. The envoy role is Ze Xie. Together, the formula nourishes and harmonizes blood, softens the liver, strengthens the spleen and drains dampness. A useful board habit is to ask what the chief attacks or tonifies, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is liver blood deficiency with constraint, combined with spleen deficiency and dampness. Look for this clinical picture: intermittent abdominal pain or cramping, dizziness, palpitations, or a pale complexion, heaviness, edema, or scanty urination. Gynecologic symptoms that match the full deficiency damp pattern. The tongue is pale and swollen, possibly with teeth marks. The pulse is wiry, thin, and deficient. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. Si Wu Tang a Euro pure blood deficiency without prominent dampness or spleen weakness. Gui Shao Ling Wan a Euro fixed abdominal masses and stronger blood stasis. Wen Jing Tang a Euro deficiency cold with channel stasis and irregular uterine bleeding. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking qi is the main driver. Safety is part of formula knowledge. Classical cautions include: pregnancy, pelvic pain, or abnormal uterine bleeding requires qualified evaluation before herbal treatment. Acute severe abdominal pain, fainting, fever, or heavy bleeding requires urgent care. Avoid self-treatment when a structural gynecologic condition has not been assessed. Modern medication review includes: Gui and Chuan Xiong warrant review with anticoagulant or antiplatelet therapy. Ze Xie and Ling may add to diuretic effects. Monitor hydration and renal status when relevant. Use a verified product. Document the complete medication and supplement list. Set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1. Bai Shao is central. Number 2. Blood deficiency and dampness. Number 3. Abdominal pain with weakness. Number 4. Pale swollen tongue. Number 5. Differentiate from Gui Fu Ling Wan. The one-line recall is, blood deficiency and liver constraint meet spleen weakness and dampness nourish, move, strengthen, and drain. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes Gui Shao Yao San. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.